Have you heard? PCOS has a new name, polyendocrine metabolic ovarian syndrome, PMOS. Before this update, I was actually already planning to do a myth versus reality on the misnomer of PCOS because it's so confusing for people. PCOS stands for polycystic ovarian syndrome, and the myth is that this condition is characterized by pathologic ovarian cysts. The reality is PCOS, now PMOS, is not just a gynecologic or ovarian disorder. Rather, it's a complex endocrine condition with disturbances in insulin, androgens, neuroendocrine, and ovarian hormones. So how did PCOS get this name? Disturbances in the endocrine system cause arrest in follicular development in the ovaries. So what this means in simpler terms is that an imbalance of hormones affects the signaling required for your ovary to ovulate consistently. So on ultrasound, we see several follicles or eggs in the ovary that started development but just never ovulated. These are not pathologic ovarian cysts and they do not cause pain. And for patients with PCOS, pathologic ovarian cysts are actually not increased either. So how do we diagnose PCOS? There are 3 criteria. However, typically only 2 of the 3 are required for a diagnosis. The first is irregular menstrual cycles with more than 35 days between ovulation. Some people will only ovulate once or twice a year. The second is some sign of high androgens, and these are male-type hormones. However, there are actually normal female ranges for them. And this criteria is either met by a blood test showing high testosterone level, for example, or physical signs like acne or body hair growth. And the third criteria is polycystic ovarian morphology on ultrasound. And because only 2 out of 3 are required for a diagnosis, you can be diagnosed with PCOS, but your ovaries actually look normal on ultrasound. And on the flip side, your ultrasound report may be read with polycystic ovaries. However, you don't meet any of the other criteria for the diagnosis. And guidelines actually recommend not to use ultrasound criteria for adolescents because their ovaries typically have a larger number of follicles, which is a normal physiologic finding. Hopefully this provides some clarity on PMOS and ovarian cysts. Stay informed, be empowered, and live well.